repeat my once again, if you don't mind. So, namaste, good evening, and a very warm welcome. I'm very happy to be welcoming Mr. Ratul Lahiri to this webinar, very unique webinar. And Ratul is a very unique person. He's a startup entrepreneur. He has started his own business after working for 7 years, Platinum One, BPO, which is doing extremely well, valued at 35 CR. And he has now started his new venture, Purple Ribbon. In that context only, I have met Ratul, and I am honored to be in his advisory board. And we had been, talking to each other, discussing about various services. And his service is totally built on nurses. And while we were talking about nurses, then he started telling that, ma'am, why nurses are not being treated like the very important people in airlines. The flight attendants are, taken care so well. And the nurses also should be treated exactly like that in various contexts when we were talking. So I thought, why not invite Ratul to this track called In Conversation with TG to understand what does he mean. And when we were planning to post this webinar, he said, ma'am, let's keep the title as Cinderella Nurse. That became even more intriguing. I said, oh, wow, now that is Cinderella Nurse. What does that mean? So we are all here very eagerly waiting, Ratul, to come to this show, which is called Conversation with TG, and very free-flowing, chat we are going to have. And we have, I can see Colonel Binu Sharma, who usually does not take much time in the evening to join, but she has joined only because she's, curious to know what is this, Cinderella Nurse. So thank you for being here. And Ratul, so first question I would like to ask is that before we get into Cinderella, very quickly that, you were running a company, Platinum One, very successfully. And what made you to start this Purple Ribbon?
So, first of all, I would like to thank you, ma'am, for inviting me for this August crowd. I think I'm really, really honored to be part of this and to get an opportunity to speak to this entire, utmost learned and, very, very enriched healthcare professionals. So thanks a lot for inviting me. Now, quickly getting to the point that what made me get into healthcare. So I'm not, just a quick background. I'm not from the healthcare sector. Neither I'm of course not a clinician, not a clinical person. So I basically, thought of, so I have worked in corporate in marketing and sales for first 7-8 years after my MBA. And then 2008, I started Platinum One with a few other colleagues of mine, which is now which is a BPO. We have an insurance business. The BPO business is now listed in Bombay Stock Exchange. It's a listed company. So I've been a Rotarian for good 10-12 years now, and involved in a lot of philanthropic activities, especially, the healthcare space, old age home, etc. So I've been slightly more, I have realized that I have that passion for the healthcare side of it. Rotary works in various domains, so there'll be education, healthcare, and also I was slightly more inclined towards the healthcare related assignments. But what got me into it is more from a very personal need that, my parents were settled in Calcutta. I am in Mumbai. So my first venture was a geriatric home healthcare. So I realized that, my parents are there and, they're getting aged, and Kolkata, as you know, is called the city of oldies, so most of our generation has stepped out of it because of, career, job opportunities, Calcutta mein utna hai nahi. So I realized that, and parents don't want to step out of the city, right? So, so he said that, I thought, let me, create that infra around them, so that I am not worried that, what is happening to them, who to take care of, who will take care of them, etc., etc. So that's my first entry into healthcare with the geriatric home healthcare. But of course, as I said, since I'm not from the healthcare background, so that was way back in 2018. And I had no idea that there are companies like Portia Healthcare at Home do exist. So when I started, then I realized, okay, there are already these big elephants, there in the, in the domain. So there are challenges. I mean, I couldn't scale it up at that point of time. I went out to a lot of investors. They said that home healthcare is not something which they're looking at. It is not very promising. Of course, I think the entire focus on home healthcare got changed during the COVID period. But, prior to that, 2019 end, I decided that, this is not working out. let me, but what happened in those 2 years of my home healthcare, I had managed a lot of palliative care cases. And I'll tell you very, very interesting thing. I mean, when I started, of course, I did it just out of passion that I wanted to serve this geriatric, community and providing whatever they need at home. I had no clue about the technical terminologies in healthcare. So I reached out to hospitals, with the hope that they will partner with me, and anyone who's getting discharged from hospital, then they will refer their patient to my previous company name was called Care Of. So, so it was with a very, very simple thought that in my childhood days, I used to get letter, right, from friends and, relatives. So in my school days, the letter used to come like Ratul Lahiri, care of, my dad's name, SK Lahiri. So when I started this geriatrics, I said then the company name is Care Of, so that we take care of our parents that way. So that was the thought. But I reached out to one of the. Just tell you quickly a very funny incident. So I reached out to this Jupiter Hospital in Thane. I'm based out of Thane, in a suburb of Mumbai, and I met the CEO there. Said that, ma'am, I'm a home healthcare entrepreneur, and we would love to associate with you and get patients. So then she asked, what all you do? I said, I have nurses, caregivers. We do blood collections at home, etc. etc. I tied up with SRL that time. So then she said, okay, so you have a team of phlebotomists. I have no idea what phlebotomist means. I said, no, ma'am, we don't have phlebotomists. So she said that you just said that you have a team. I said, no, we have a team. I mean, they're there for blood collection. Then she realized that I'm like a complete novice. She said, they are called phlebotomists. So that's how I started eventually. But yeah, I mean, since then, so that's the journey. But what I did quickly is I realized that if I have to be in home care or in healthcare, I think quality is the utmost thing that I need to focus on. And I quickly got in touch with, I somehow, got in touch with Dr. Rana through LinkedIn, who's QAI CEO now. And at that time, he was formulating the home healthcare quality standards. And I really, chased him and said that, sir, I want to be a part of, this training program, and I want to be a quality assessor. So he was like kind enough to get me in, though I'm the only one outside industry. And he said that we are only allowed, our board allowed you because you are from the outside industry. So we thought that you may bring in some different perspective. I think I think they are quite happy to get me in, because I'm the only one who's from the non-healthcare. And therefore, a lot of my thoughts are very, very patient centric. So whatever, came from my perspective are more from what patients are going through and what they need. And so that way, I think there's a lot of value add I could do. And hence I'm a part of the technical committee of QAI, more from that, that I wear a very different hat as compared to everybody else. So yeah, so that's how it is, ma'am. And I think Purple Ribbon started in March 2020, because as I said, cancer, I realized that is a domain where the need is much more stronger of quality caregiver. The patient has much more pain, not only from a care perspective, but also emotional, financial, multiple aspects of it. So that's how I got into Purple Ribbon, and the objective of Purple Ribbon is to bring cancer care. So we focus on chemotherapy. So we're creating chemo network. So primarily the objective is to create a chemo daycare network closest to the patient. So the idea is that patient should not travel. We should be coming close to the patient for giving treatment. That's what the philosophy is.
Yeah, fantastic thought. And I totally agree with you that a lot of patients who actually start their chemo, they drop off because of the long distances that they have to travel, and
Right.
a lot of logistics to manage, the family, who will go with them, who will stay with them. I had I have a personal experience when my aunt had diagnosed with ovarian cancer, and she was in Mumbai, though her daughter was also there in Mumbai. But even traveling within Mumbai to go for chemo was like a nightmare for them, because the whole day, it was gone. Somebody had to
Yeah.
be patient, and so I can understand the predicament of patients and their families once they get into these long cycles of chemo. My heart really goes out to the family and the patients. So that's a very unique thought, that you want to bring the chemo closer to the patients and their family. That's a fantastic thought. A little bit coming away from the patient, away from the family, coming back to this unique word called Cinderella Nurse. So I would like to pick on you to why did you think of a Cinderella nurse? From Queen, you said, I will change this to Cinderella Nurse. So tell us
Yeah.
about it.
So I think, my entire concept of Purple Ribbon is centered around nurse. Uh, and I want to touch upon that first before I come to why, I'm so, close to this entire fraternity and want to build around a different, completely different, service aspect around the nursing fraternity. Uh, so the Purple Ribbon model is completely dependent on nurse because you know what, I'll tell you some facts that there are just about 3,000 oncologists in the entire country, and these 3,000 oncologists are concentrated in the top 60-70 cities in India. They're only in this 60-70 cities in the entire country. We have 764 districts in India. So imagine there are 764 municipal boards, where we have population of 1 million plus, right?
10% we have covered.
Correct. So then, for a simple daycare treatment like chemotherapy, a person has to travel 100-150 kilometer plus on every month, because chemo is not a one time, it's on an average 8 to 10 chemo cycles. And my observation is that chemotherapy essentially is administered by a nurse. Even in a hospital, the oncologist is nowhere nearby. I mean, he is of course in the OPD looking at new patients, and the nurse, and there is an RMO who's there, for the sake of being there. But the nurse is the one who is managing the entire end-to-end chemotherapy. I mean, even there are nurses who are doing central line in the OT. So which also even more commendable. But there are of course the chemo essentially is entirely handled by nurse. So then the hypothesis is that if a nurse is doing it, there are nursing homes in every district, every small town, and which has nurses everywhere. So why can't we empower these nurses, train them, certify them, give them the entire know-how, and make them equipped to do chemotherapy in the same small town where there's a nursing home. So eventually, why can't we have 760 daycare centers, one in each district, so that patient doesn't need to travel out of their district town? So that is the entire concept. But that's why I'm saying that the nurse is a central focal point of my entire business model. And I have been thinking, so everyone whom I speak to in the industry, so they said that there is a huge attrition problem, there is a huge supply issue. Nurses are going to UK, and so how are you planning to do it? Somehow I feel that we're talking about the problem, but not looking at the root cause of it. So we're it's a cause and effect, right? We're looking at the effect and not looking at the cause. And there is, I'm sure every one of us looks for a certain, so there are anyone goes to a job, I think from a job perspective, there are 4 or 5 things that we look at it. I mean, Maslow's hierarchy, right? We all have heard of it, that the basic need, and then it goes up. So from a job perspective, if you look at the lowest thing is pay, that everyone looks for the basic money part of it, salary basic aana chahiye. Then the perks, that what are the perks that we are getting in on top of my salary? There could be like health cover, there could be free stay, quarter, etc., things like that. Then there are people, that whom are we working with? So do we gel with them? What kind of colleagues that I have, my bosses, etc. And then comes pride. Okay, so if all this are there, then I am working for the organization. If I'm very proud about what I'm doing, my profession and all. And then the top of it is the purpose, right? I think very, very, very interesting thought. When I've been looking at this model, and specifically in nursing fraternity, I think they have missed the entire lower, the all the slabs on the lower side of it. Pay kam hai, perks pata nahi kya hai, nahi hai. People, so they are always busy in managing patients and listening to galis. So I don't know what enjoyment that you get once you step into the hospital. There is always pressure, and I see the stress in every nurses. I got malaria twice. I got admitted. I never seen the nurse smiling at me. So I could imagine the kind of stress and that they go through. Pride, I'm not too sure. I guess there is some amount of pride in the nursing fraternity that what we are doing. But very interestingly, all of them work for a purpose, and which is actually supposed to be the topmost. Ki niche ka sara fulfill hoega, fir purpose pe aana chahiye. But here only the topmost is taken care of. They have a very high sense of purpose of serving people, right? but niche ka pura bikhra hua hai. So that's where I said that, it's a Cinderella nurse, because if you look at that character, she's doing all the household chores, sab ghar ka kaam, is treated like a maid servant, but then she's actually a princess, right? I mean, she became a princess. And there's the king recognized that, okay, this is a lady I want to get married to, and whatever the story behind it. And then he found this girl, because this girl went for a ball. Of course, one pair of the shoe got lost, and with that pair of shoe, the king could find out that, okay, who has the other pair, other pair shoes. So, and then he found out, and finally she became a princess. So I think, this entire, I see the entire, in a hospital business, 90% of the work is done by the nurses, or even more. Okay. But whom do we recognize? The doctors. Whom do we recognize? The hospital brand. So, I think in my stay in hospital during my, whatever, twice malaria times, or even in my family member, whenever who got admitted, is just 99% of the time we're interacting with the nurse every time. Like, they are coming, sir, what do you need? Even whether it is giving medication, you have a bell. Every time you press the bell, the nurse only comes, right? The doctor comes once in a day, right? I think, but if you look at it, once we get out of it, we thank the doctor and not the nurse. So
I kind of relate to it. So what you're, Ratul, with your experience, what you're trying to say is the nurses are like Cinderella, doing all kinds of work in the hospital and not recognizing that they are the princess of the healthcare. They are the, I have heard a lot of people saying nurses are the heart of healthcare, nurses are the spine of healthcare, backbone of healthcare. Many descriptions have been given to nurses, and especially that happens very often in May, because May is the nurses month, so everybody keeps praising nurses.
it's like, it's like celebrating Mother's Day. We forget mother on 364 days, and on Mother's Day we put, a picture with our mother and post it on Facebook. So
I kind of relate to it, but it's a very interesting perspective coming from a person who is not from healthcare. And I think, yes, there is reality. Like, it may not be that all nurses, are in the same, that they have only this. Very interestingly, you put this picture that most of the nurses, probably they have the purpose right there, that we want to serve the sick, and people who are suffering, and the rest of the things below that hierarchy is probably not taken care of. So what I understand is that in Purple Ribbon, you are planning to make these nurses the real princesses of your service, or the queens of your service.
yep.
That's what attracted me to your venture, because you had very clear intention that the nurses who work with you should be taken care of, right?
Absolutely.
Great.
So I will touch upon that, ma'am. I think, since, any organization grows with the people that they work with, and for me, is a nursing team, and therefore I believe, I mean, it's not only from a business perspective that I, of course, there is a business angle to it, that how do I retain, how do I attract the best of the, talent in the organization, but it's also about giving their dues. Okay. And that's why when I was chatting up with you, that when you fly, when we fly in a airline, whether it is, I mean, the earlier days, it was like, if you look at Jet and Kingfisher and all, I mean, we're paying how much? We're paying 10,000 rupees per ticket, right? And we are treated as a king, the kind of treatment as a customer, as an airline traveler, we are treated like a king in that airline, right? And the nurses are equivalently treated, given that kind of pampering by the airline organization. I mean, they have like, they get, I mean, they are not, whenever they're flying from one airport to another, and whenever there is a night stay, they get a stay in a 5-star hotel. They don't get to stay like, acha, pilots will stay in 5-star, and the nurses and the air hostess and the crews will stay in a 3-star or 4-star. Everyone stays in the same category of hotel. They also get pick up and drop and everything, right? They have a flexible working hour. They get, I think 7 or 10 days of off in the entire month. So I think, in any organization where the dependency is on a specific profile, like, airline, they understand very clearly that why Jet or Kingfisher was better than everybody else, because the way the cabin crews took care of the passengers. I became a loyalist of flying on Jet or a Kingfisher at that point of time. Ki, haan, yaar, I get the best of the treatment. I get treated like a king because the cabin crews are trained like that. So I think that's where, from a business perspective, I think the repeat business, the loyalty, the customer, coming back again, is from the lowest point of touch point, which in case of airline is cabin crews. In case of hospital, it is nurses. If the nurses are treated well, the way they treat the patient in 99% of the time when they are admitted in a hospital, come what may, I will come back to that hospital.
So great. It's a very different thought coming from a non-healthcare person. Colonel Binu is asking whether she can ask question or make some comments. Colonel Binu Sharma is the Senior Vice President at Max Healthcare. She heads a large contingency of nurses and, many hospitals. She heads the Max Healthcare group of hospitals, nursing division. She's got long experience behind her. She had been a colleague and a friend of mine for many years, and she's here because she's interested in Cinderella Nurse. So I will request Binu that, any questions or any comments,
Sure.
even for others, this is like a conversation here we are having. Don't worry, but please stay on the video.
Thank you, Tangam, for that. And thank you, Ratul. I really was very curious to know what are you going to talk. Although I was trying to understand the relationship between a nurse and a Cinderella nurse. So first of all, I am very appreciative of your thoughts. Pardon me, but I do not know much about the purple ribbon. I do not know the number of nurses you have with you. And also, are you in a few cities or are you spread across the country? Why I'm asking that question is because nurses in hospital, you said nurses should be the unique selling preposition for which patient should choose the hospitals. But the hospital business leaders do not really think so, because they do feel that the business is driven by the doctor name and not by the caregivers. That's number one. Secondly, our patients, however great nursing care they would receive, when they have to choose a hospital for a clinical service, they do not really go to the depth of finding the excellence of care by the nursing team. They still go which hospital is good, which doctor is good. And for them, hospital means maybe the building, the hygiene level, especially after COVID, and otherwise the doctor in that specialty. The last factor they would ever think of is a nurse, even though they would have a prior experience of excellent or bad or average or above average nursing care in a hospital. So it is a very dicey situation. The community does not pay so much attention to the nurses. Yes, when things don't go right, they are not kind to the nurses. They would give their feedback. And hospitals do have their own different kind of thoughts. And rightly so, the nurses are going to other countries because they want the basics to be taken care, the base of the pyramid to be taken care, the second level to be taken care, and the pride factor to be managed. The passion and the purpose is there in every single nurse. That is the reason she's into the profession. She may not have joined it with the thought that she's going to do an outstanding service to the community. Not always. They're very young when they choose the profession or when they come in. But once they come in and they see their seniors dedicated and committed to the profession, they have enough role models in nursing and they start following that, and the purpose and the passion makes them to continue in the profession. and they would stay in the country as long as they can stay. If their needs are critical on financials, etc., they would go to other countries. So I am coming back to my question on Purple Ribbon. What is the number of nurses you have under the banner of Purple Ribbon, and is it at a national level, or are you in only few places as of now? That's for my understanding.
Yeah, sure. Okay. So thanks, ma'am, for sharing your thoughts and feedback. But yeah, so coming back, so I think I'll answer one by one. So right now we are very small. Purple Ribbon. So we are only operating in Mumbai. I have 5 nurses, and I think 10 odd. So another 10 freelance nurses. So they are so they are not on the payroll, but they are all nursing, and we engage them on a time-to-time basis when we have more number of patients. So we're just a 2-year-old organization, and now we are looking at scaling it up in Bangalore, Hyderabad, and Delhi. So that is where we are currently from a current strength and the the spread perspective of the organization. And I think what you said is very, very right. I mean, I think the fraternity. See, I'll tell you what, ma'am. I think I'm telling you more from my experience as a patient. Okay, I think what you are saying is from staying inside the hospital and your interaction with the doctors and the hospital management. But you're on mute, ma'am. So
I know. My experience, I'm putting in all comprehensive, the hospital's point of view, the administration point of view, and as I said, patients there is no nursing care listed on the website of a hospital, grade of nursing care or level of care given in that hospital. The sales and marketing team does never sell the hospital based on the quality of care. They do say in a statement world-class care or world-class quality, by which they always mean world-class doctor or world-class building or world-class equipment. They never mean world-class people or caregivers. I've never seen a sales guy over in sales and marketing. I've never seen them selling. And in every board meeting, that is my point to everybody. Why don't you sell nursing care so that people start differentiating the organization based on the care, not just based on the building or the equipment or the doctors. So patients do not know what kind of care they are going to get. Once they come, they get a good care. That's a different matter. Yeah.
Right. So I think you are absolutely right, ma'am. But I think that makes my part of the job very easy, because I think, if the entire industry is not looking at it, and I feel if I'm able to make a difference in that segment, it will possibly make some amount of mark. But as I said that, I think majority, if you look at even from a very, very clinical perspective, right? So my dad has gone through a bypass heart surgery 10 years back at Asian Cancer Hospital in Mumbai. Okay, we went to the best of the Dr. Ramakant Panda, known to be the one of the topmost heart surgeon. So he did a surgery for 4 hours. After that, my dad was admitted in that hospital for 14 days. And there was like rehab program, and there was a some complexity, and it is completely on nursing team. So now I think I am such a diehard supporter of that hospital, because if anyone I get to know in the family, I said go there, because the post-operative care is the best in this hospital. So I think, which is where I understood very, very clearly, because I have seen some other relative of mine who got operated at R.N. Tagore Hospital, which is supposedly Devi Shetty's one of the unit in Kolkata. The operation went very well. Unfortunately, the post-operative care was not good, and I lost the relative. So I think everyone understand that the post-operative care is like almost 50% contribution to the well-being of the patient, and which is entirely on the hands of the nursing. And now I don't know why it has not been highlighted within the hospital, and what will it take to to bring it up on the table and make it more publicized. But this is even known fact even by the medical fraternity, that post-operative care is completely the nursing domain, right? And which contributes 50-60% of the well-being of the patient, even after the, you are right, your doctor ke naam se patient are coming. but that is only the entry of the patient inside the hospital. But after the entry, the entire experience of the patient is with the nurse.
We all know that, everyone knows that. But again, I said, despite all of it, it is nowhere publicized on the website or in any other format that the nursing care of this hospital is a differentiator. So come back to this hospital. So we don't have any data on footfalls or repeat admissions or repeat patients coming to a hospital because of the nursing care. That data is missing. Nobody captures that.
So if I may interrupt, Ratul, that's a very interesting thought that Binu has brought in, that despite the fact that nurses play such crucial role in the clinical outcome of patients, and the doctors, they are like the director of this entire journey, they kind of direct, but everything is executed by the nursing team. So the outcome definitely relies on the nurse. As Ratul told, surgery is done, but what happens after surgery is dependent on the nurse, who is vigilant, observing, informing at the right time to the right person in the right way. I totally agree. And while Binu was mentioning, I think this is something that I'm also taking a cue that, at the different formats and different forums, we have to now assert to say that the nursing cadre should get a show on the website. Like in abroad, if you go to the major hospitals, there is a nursing service, tab there. So when you click the nursing service, you will either find the nursing director's message, and they will have their mission, vision, and values, etc., and how that nursing service works in that hospital. In US, I have seen many hospitals have that on the website.
Yeah.
Maybe that is one place to start with. And the other discussion, Ratul, in other groups have been that, why nursing should become a center of cost. Why don't they become center of revenue? Because they are giving service. Unfortunately, in all the hospitals, the budget, when it is paid, nurse is a cost of, center of cost. But if you look at abroad, the nursing actually manages the entire revenue.
Absolutely.
It's not the doctor.
So I have statements here again. Nursing, I mean, those thoughts are definitely changing, at least in the corporate world. Although everyone thinks nursing is still a cost center, but they at least speak up openly that this critical cost is imperative to our business. It's critical to the core business of healthcare. So we have to spend or we have to invest. That has been an accepted thing in the corporate world, at least. Down the line, I'm not very sure. Okay. But nursing also has revenue. If you look at just the cost part, the 90% of the manpower cost goes to the doctors, and the 10% or less than 10% of the manpower cost comes to nursing, whereas you just said 90% of the work is done by the nursing team, and 10% time of the doctors, or maybe less than that, is spent in the patient room, because they are busy either operating or seeing patients in the outpatient, etc. So primarily, care is dependent upon a nurse, outcome is dependent upon a nurse, a patient's healthy, safe exit is dependent upon a nurse. These are the three core businesses of a hospital. So all of us have to strongly advocate that
Absolutely.
Let's change the way we are treating nursing, or let's change the way we are showcasing or marketing nursing in the country.
Exactly. I think Ratul is one loud voice in this, so many voices. Ratul has come up with a loud voice.
I think, ma'am, there are a few things I've been thinking that, why no hospital as a CEO who comes from a nursing background?
Right? There are, even in India, there are.
Okay.
But
okay,
those
great.
very, very minuscule number, it has just begun.
Absolutely. I think, if you look at somebody who has, if primarily, what is the skill set that you look from a person who can run the hospital? Majority of the hospital is, the entire administration. There is one part of it which is like finance and all those other things, business, sales, etc. But I think what I feel, I look at nurses, primarily, I think there are some of the skill set. I think I would request the leaders here who are present, if you can advocate. I mean, there is some upskilling which is needed, because nurses possibly will get into upskilling themselves on the training on their own clinical side of it, right? But I think there are other areas where more on the soft skill, on the leadership. I mean, as like Sankam ma'am, of course, I mean, you focus on the leadership training part of it. But why not they get like a hospital management kind of a course, so that they become their ambition is to lead the hospital and not to
The
become
journey has begun, Ratul. That
great, ma'am.
journey for corporates has begun. Nurses are getting trained as managers and then as leaders. Nursing leaders understand EBITDA, P&L, balance sheet, cost, profit, net cash flow, margins, everything. They, I mean, I'm part of the journey, so I know. We all understand. We can rip apart the P&L the way you want it. So all that journey has begun in our country, and I really appreciate that those initiatives. For nurses to be showcased, not all nurses have to take the journey of becoming a hospital head or a CEO. Whatever role they are doing the nursing leading. I think hospitals have to broaden themselves up in terms of showcasing, recognizing, and marketing their ability and their excellence. That is what is important. That is
Absolutely.
where people like you can come into the role and become strong voice. We are already strong voice for nurses. People
Yeah.
like Tangam and many others in this call right now. All of us are trying our best to stand up and make a place for the nursing in the country. But we need more non-nursing people, leaders, to become a stronger voice for nursing.
Absolutely, ma'am. I think, there are a few things. If you look at benchmarking, as I said, I mean, I just gave an example of airline. Also, if you look at hotel business, okay. Now, if you stay in any 5-star hotel, right, and the moment you check out, they will give you a feedback form, simple, that, whether, like, in terms of your experience in the, in the housekeeping, in the cafeteria, in the kitchen, so on and so forth, right, at the check-in, check-out. So you fill up a complete feedback form, give rating, so on and so forth. I think the rating is crucial for their own appraisal, that if somebody gets mentioned in that feedback form. Now, many of the hospitals today, corporate hospital, and I understand that some of them are, of course, quite leading in Delhi NCR. They are trying to, they're looking the hospital business more like a hospitality business. And therefore the management is coming from, some of the leading hotel chains. And I know that, so there are some of the, CEOs of the hospitals are joining from Oberoi's and all, because they're looking at it more like a hospitality business, that how do we give more, like a hotel kind of an experience to the patient who's coming in. Now, but I think, they're just doing a part of it. I would, therefore request the leaders here that look at them. Why don't you, look at the overall aspect, whatever they're doing, then don't do half of it, then do entire thing of it. So if, for example, a patient is stepping out of the hospital, I'm sure if you take a feedback from the patient, there will be definitely mention of the nurse who has taken care of that patient. You mentioned that, there are data not available, but there are clinical data of readmission, which is there, right? There are data of, like, as I said, there are multiple data which can be correlated directly to the nursing services. Just that, it is today not been tagged with nursing service. So I think it's not a very tough task to establish the efficacy of a good nursing in a lot of this readmission and things like that, whatever you're talking about, or on the PNL side of it. So where the difference that a good nursing fraternity is creating to the hospital balance sheet can be very well established.
I totally agree, Ratul, that the changes are happening slowly. It's very slowly. It is happening in small segments here and there. And I'm just seeing in the chat box also that, many nurses, they don't like to move out of the country, provided they get the remuneration, respect, perks, privileges, and flexibility of work schedules. Now, these are all nice words to use when we are in the healthcare. So see, it's like somebody was telling, managing staffing, it's not an easy task. It's so complex. It's so complex that it is actually almost like managing a devil that you don't know what you're going to do, because it's very complex. You did talk about hospitality. In hospitality, I have been in healthcare for long time. So when I look at hospitality, I'm totally a corporate person. So I do understand that, many people would like to keep the hospitals like the hotels. That's good. But there is one very important difference between. One is that in hotels, most of the stuff is predictable. You know that this person
Correct.
will come at this time this person will check out, and this time they will have their dinner, everything is predictable. But in healthcare, nothing is predictable. Even in a predictable case also, things can become unpredictable. So it's a highly volatile environment. So you need people, you need leaders who understand the intricacies of such a system, who understand, empathize with the people who are within that volatile environment.
Yeah.
So when you look at this 22 years old, young boys and girls who are working in such complex situations, you can imagine the kind of stress that they would be going through. So we just had, as part of the Association of Nurse Executives India, we had our conference last week, and I was also there. So one of the project that was presented, which won the first prize also, was reducing the attrition of nurses. I want to say it here because there are many mid-level and senior nurses sitting here. So what they did was not anything. They only worked on the mid-level leaders to whom the young nurses are reporting. So the project was on Gen Z. And I was joking to myself, I hope the young nurses, they are aware they belong to Gen Z. Whether they are even aware that they belong to Gen Z and they have a certain special characteristics. But anyway, in that project, they worked with the in charges of the Gen Z. And with that, they brought down the attrition by several percentage. I mean, I was really heartened to see that. And because this is something I really believed, because this words, respect, privileges, perks, flexibility. So there's an old saying, that people don't leave the job, they usually leave the boss. Or the environment, because the environment doesn't fit, or the boss. I totally believe, me being from the nursing fraternity, I believe that a lot we can do within nursing to start with, because I'm sure that level recognition will automatically come when all the nurses, their skills and their competencies reach a certain level, which cannot be neglected by anyone. So in Purple Ribbon also, you are planning to give chemo in distant locations by having credentialed certified nurses.
Yeah.
But the doctor will be available at some distance, that he has agreed that you can take this chemo safely in a remote location. That's your plan. So when these nurses, when they get into that, when they repeatedly are available to the patients, very soon the patients are going to trust them completely.
Correct.
They will come back. They'll come back and say, because this nurse is there, that's why. And that's what happens in public health centers, community health centers, because I'm not aware, I mean, having any experience, but I'm very sure when the nurses there, when they do a differential work, the community starts trusting them. They will come back to them. So I'm a very optimistic person, and I always believe that don't wait till everything falls in place to say, and now we are going to deliver. So I think all of us need to assert in whichever situation we are, and to see that our nursing nurses are, upskilled, skilled in the right manner, in the right level, in wherever, this, whether it is onco or it is, critical. So important that they are skilled enough so that, everybody will see. And doctors would otherwise say that nurses are indispensable. If you ask any doctor, can you work without nurses? They will say, no way. I always used to say.
And also, ma'am, one point here specifically, a lot of doctors want that specific nurse. They want to work only with their own set team of nurse. I mean, if nursing has been so, like not so critical, they would have been okay with like any nurse getting replaced, right? But they want that specific nurse because he trusts that nurse so much, right? That is
Yes.
one part of it. I think also one thing, ma'am, I'd like to highlight here. Of course, there are large, Binu ma'am is part of a very large institution, and large hospitals have their own ways of working. Unfortunately, I think, the entire medical industry are slightly more conservative as compared to the other sectors. I will not say unfortunately, I think it possibly is a needed reason also, because it's healthcare, you need to be very, very cautious and all. So I'll take back that word. But I think, there are a lot of changes happening with the technology coming in, with a lot of, I think the mindset also changed due to COVID, the way remote working happened, right? We need to be open to embrace those. I think we cannot. Abhi mera thoda, I feel bad because once the COVID got over, people went back to the old state of working. But why? I mean, you got a very new style of working, which is more efficient, and you can use people more efficiently. Like, I'll tell you what, ma'am. Today, as we are in this call, my nursing head, Margaret ma'am, she is a retired chief matron from Railway Hospital, Baikala, and she is in Kerala attending some marriage. And my work is not so, because she's the only. I mean, I have a very small team. She's the one wholesale managing it. So my purpose, my objective is very clear. Ki ma'am, मुझे नहीं फर्क पड़ता आप कहाँ छुट्टी पे जा रहे हो, whether in Kerala or Goa, I don't care. The work should happen because we are in the healthcare sector. The patient, treatment continuity should not get impacted. And she's on the phone because, that's what I don't need her to be in Mumbai sitting in my office doing it. Today, I, just messaged her, ma'am, we are starting this call. Can you please join? She said, I am coordinating with a patient. I will not be able to join. And she's in Kerala attending a marriage. So I think, these things have made, even the hospital, I know there are some hospitals that are working on a remote, but now that, they are again got back to the old style of working, maybe some of it, majority of it would be needed. But I think some 10-15% flexibility could be given to make changes, and which will make life better for the people. I think, and when I'm saying people, is for nurses.
I totally agree with you, Ratul, because there is a lot of discussion happening on innovative staffing models, because I read about the opportunity, and even they are looking at virtual nurse mentors. Like, let's say, for example, like Margaret ma'am or somebody else who is retired and they don't want to come to hospital. Can they become virtual mentors for
Correct.
these young, and they are saying they are even getting them on video to talk to patients, to explain to them certain matter, because the experienced nurses, they know exactly how to explain things, and young nurses, they are still, learning. So at the maximum, they will probably repeat whatever script you have given. It takes time for them to know where to modify and adjust to the patient's, requirement. So I totally agree with you that it is time for all the nurse leaders to think out of box, because we keep on repeating the same thing, that whatever we have done so far, if we continue to do the same, we cannot get any other results. So we really have to think out of box and, think differently, that ask that why not? Why should we, get ourselves stuck in the old ways of doing the same things? When we talk about flexibility, it is for us nurse leaders, because it is nice to have people like Ratul championing, telling that, the Cinderellas need to come out and become real princesses. They cannot be the version who was at home doing all kinds of work and no recognition. That's why you called as Cinderella Nurse. So there are some leaders sitting here. My shout out is that, just unhook all your, boxes, whether there are tapes or, buttons or whatever. Just remove everything from your mind and think out of box and talk about it. Why not do something totally different? Why not? When You talked about giving chemo distant. I had a lot of questions to you. I said, how will you do this? How will you do that? I asked you a lot of questions. You are very well prepared. Now, to work in that capacity in your purple ribbon, there may be nurses who are willing to do that more more skillfully than working in a confined role of a hospital nurse. So there
Correct.
is flexibility coming in the job role, because there is home care nurse, there are other roles that are being designed in many hospitals abroad. They are trying to mitigate. They have a larger percentage of not experienced nurses. You really cannot drill experience into their head. It's not possible. They will have to live that job for some time to gain that experience. Now, to offset that, how do we leverage the smaller percentage of experienced nurses? So it is now time, as you said, to think, is there a technology that can come and help us? So when you are also going to put all these nurses in remote, I'm very sure that you will be looking at the technology piece to say who's going to
Absolutely.
supervise them remotely. Maybe somebody is going to be on a video call. Somebody is going to be on video to tell the patient this is what you expect and this is what the nurse is going to do. Somebody is going to observe the staff doing what they are doing from a remote location, someone who is experienced. If we don't think out of box, we will not get out of box results. I'm very sure of that.
Yeah, I
Thank
think
you for
it's very,
touching
very
on technology.
critical that the nursing leader here, you have to talk for yourself. So I'll just give a very simple, another thing, very, very simple. I mean, there are something which doesn't, you don't need to move mountains. But, for example, in home care, and, if I call up for a nurse for getting an injection, for giving an injection at my home, the nurse who comes from the nearby hospital, she comes in a Maruti Eco, which is like a ambulance, a Maruti Omni ambulance, and she comes in that. But if I call, if a doctor comes, he comes in a cab, right? He doesn't come in. You have never seen a doctor traveling in a Maruti Omni ambulance, right? So I think just, that simple thought that why can't, I mean, it's just a matter of giving that respect, right? And possibly if you make that nurse, if you say that, okay, you can take an Ola or an Uber and go to the patient home, that makes a lot of difference, I'm sure, in the nurse rather than, but then that's a norm. But I think, there are some very basic thing I'm going to challenge. I'm going to make change. And I'm sure these are not something that I don't need to, as I said, you don't need to move mountains. But I think, these are small things which makes a lot of difference in the mindset of the people that we work with. And I'm talking of nurses.
I totally agree with you. What a classical example that when a doctor comes, he comes in a cab. When a nurse comes, she comes in a Omni. I think if we can make that small change, obviously the nurses are going to feel very respected. I think that's one area that many of us, including me, all the nurse leaders, can look into, to say it was a struggle. Even me as a nurse leader, it was a struggle long time ago. I still remember that when I sent my nurses for an outside camp, I did not know the Indian, healthcare much. I worked mostly abroad, and I was a critical care nurse. I was mostly inside the hospital. So this was many years ago when I sent nurses for a camp, outstation camp, like marketing. So when they came back, they were up in arms and they told, ma'am, we did not get the same food. We did not get the same stay. Nothing was at par with anyone. So that time, all I could do was I told the marketing, next time I'm not sending a single nurse.
I want to give an example here, Tangam.
Yeah.
Again, on the same thing, some of the operation theaters in one of the organizations where I work, in the operation theater had a lounge. The lounge writes doctor's lounge. And in that, there's a coffee machine, there are easy chairs, etc., etc. And only the doctors would take a break, have their food, have their coffee, tea. And if nurses did have access to coffee, but it was given to them in the same change, in one of the change rooms. And I saw them sitting down and eating their food on floor on a carpet. So I walked in and I asked them, you don't have a lounge? They said, madam, that is a doctor's lounge. I said, okay. And I said, do the doctor stop you from entering that lounge if you want to eat your food there or have your coffee? They said, we don't know, but it's written as a doctor's lounge, so we don't go there. I debated with the authorities. I changed the doctor's lounge to staff lounge. Doctors
Exactly.
are also staff of the hospital, and the nurses are also staff, technicians are also staff. There was a lot of resistance initially. I said, why? You want nurses to work for 10 hours, 12 hours, do your liver transplant, CABG. They should have access to the same lounge. If that is falling short, you extend, make one more lounge, I don't care. But everybody will use the common lounge, common coffee machine, common access to seating. That's it. After all the debate I had across all the hospitals, we changed that. And that's it. Doctors had no problem to it. It was the mindset of the people, the administration, the authorities. But the moment we picked it up, we changed. Like that, we changed the change rooms. We made common change room. Otherwise, it was a doctor change room, a staff change room, nothing like that. I said it has to be a male change room, a female change room. All males go to one change room, females go to one change room, whoever they are. There should be no differentiation in these basic human requirements. And we were able to change it. I mean, it just took some initiative and making people understand in an open statement that why the discrimination. That's it.
I
So
think
we have to feel our worth. Yeah.
Absolutely.
I think it is probably time that we need to also assert as leaders. We need to assert. Even today, when hospitals are being constructed, they will make cafeteria different. This doctors, cafeteria and for others. I think that is kind of reinforcing the same factor again that we are there. See, nobody is saying that in the hierarchy the doctor could be higher, but that does not mean the respect is not the same. Respect is the same for everyone. It doesn't matter. Everyone plays a important role in the nursing team, so if we have to get a collective better results, even want to make a small difference in the retention or the attrition of nurses, maybe these small things, when you change, you will probably see a difference. And that
Yes,
enough of
definitely.
research has been done to say that if the work environment improves, people will not leave that easily. They still may not go for 500 rupees and 1000 rupees if the work environment they find it very suitable.
Correct.
Because they are not liking the work environment, they'll say, okay, 500 rupees more that side, let me go. I usually tell them कि it is like it looks green from this side, not necessarily knowing कि वहां जाएंगे तो वहां भी वैसे ही हालत मिल सकता है. So this such dialogues are very important. I think we are already having such dialogues in multiple platforms in many different ways that we all are discussing. That itself is a great beginning. I think that it's very important that we discuss these things, and hopefully I do not have intention of stopping all these dialogues anytime, and probably through our association we will try to make a representation, because that's a commitment that we have given in our association. Today I'm sitting in my company, but Istankam is there, or here is Istankam. So we have promised, we have got an action plan for unsiloing nurses. That means that we have to find ways of incorporating nursing into all the other departments in the hospital. We have to do it. And it could
sometime now, I'll just tell you, sometime you talking about it will not make a difference because you're talking for yourself. Let a third person talk about it. And generally what it happens is that as an association, and just again, I mean, I'm just giving us uncalled for suggestion, and pardon me if I can ask you for forgiveness later on also of stepping out of my shoes. But I think ma'am, it is worthwhile to consider a situation where you engage a big consulting firm. Like, and I'm just saying from a very different corporate background that I come from, that if you look at engaging like a PwC or an EY or a McKinsey kind of a thing, that how nurses in India are making a difference in the hospital P&L. Okay. And if a report like that comes and on the table of every hospital management and CEO, you don't need to talk about it, because that.
Ratul, I am becoming very greedy. I totally agree with you. Please put us on to one of these who are pro nursing. Now, all these big consultants are also working for the same corporate hospitals. So somebody has to have the courage to now write.
No, ma'am, but I think it is not that they are writing against the hospital, right?
Not against, I totally agree.
So
but then they have to be candid with some figures, etc., to say that this is the contribution of nurses. We will be more than happy, Ratul, put us in touch with any of these biggies, someone who is willing, because right now is the right time, because every second day, third day, something or the other is written on nursing in the media. It was not like that. Government announced 157 colleges to be opened. Now government knows the nurses from India is going to go abroad. They know that we are going to be the supplier, and we are also short of nurses. We need to have a lot of discussions around all these points. I think paper comes out like that. I totally agree. We nurses should not be within nurses talking about our own problems, talking about potential solution. It doesn't work like that. We
Correct.
have to get the CEOs, the CFOs, the CHROs of the world to get into such dialogues. I really hope, and this is the beginning. And Ratul, I know we scheduled it for 1 hour. We are just crossing 1 hour. I know when nursing discussion starts, it never ends, And I can see that a lot of leaders who are interested, they're like young leaders, not as senior as Binu or me. I can see some names here. They want to make a difference, and I really hope together we can make a difference. And Ratul, I wish you all the very best, and walk the talk that you are, because once whatever action you're going to do for your nursing team, as it spreads across the country, that will be a talk of the town. So
thank you so much, ma'am, and thanks everyone. I think I need everyone's blessing. I think, like in old days, golden days, I mean, people used to take blessings of the guru, right? So for me, as I said that, and that's how, very specifically I reached out to Thankam ma'am that, I have not seen, and I will not take a credit. I would like to take a credit for it, actually, that I have not seen any other healthcare company or even a home healthcare company having a nursing lead on their advisory board. And whereas it is like driven by nurses, I mean, if you look at specifically home healthcare companies, is driven by nursing fraternity entirely. So I think for me, it is very, very close to my heart. I believe that this is where, the entire change happens. Have to, push really hard to convince ma'am that why you should be on the advisory board of Purple Ribbon, and why, I want to really genuinely want to make a difference. And in the entire healthcare fraternity, at least with my small organization and small effort that I want to bring in. But I think if any difference that I can make in the patient's life is by making a difference in the nurse's life first. So that is where I am, and I think thanks everyone for hearing me and listening to me for last 1 hour, and thanks Binu ma'am, great knowing you. Need your blessings, and of course we'll
Thank
be
you, Ratul. Would
Thank
like
you.
to connect with you for some more stuff.
Sure, ma'am. I'd really be. It will be my honor and privilege.
Thank you.
Thank you, Binu, for being here and adding value to all the discussions. And thank you to all the leaders who are around and all the young ones who are here. Please remember, while we discuss all the problems that we have, the future is bright. It's like Cinderella. We will find our magic shoe, and we will have our time like Cinderella. That is what I would say.
Thank you, Tangam.
Thanks a lot, Ratul.
Thanks for organizing this great thing. Thank you, Ratul.
Thank you.
Thank you so much, and take care and good night. And love you all, my nurses. We'll meet again, and we will put you in touch with you.
Thank you, ma'am. Thank you so much.
Thank you.
Bye-bye.
Bye.
Thank you so much.
Thank you, ma'am.